Welcome back. It's that time in the program where we put your COVID-19 questions to our panel of doctors. And tonight there are questions that some of you tweeted to me. And providing the answers, Dr. Michael Curry, an emergency room doctor in the Vancouver suburb of Delta. And in Edmonton, Dr. Lenora Saxinger, an infectious disease expert. And Dr. Saxinger, first question to you. Is there a ballpark estimate of the number of asymptomatic people walking around, given only those presenting symptoms are being tested?
This is actually pretty much the million-dollar question right now, and you can find data from various sources that gives numbers anywhere from 5% to 80%. The more reliable data looks like it's probably 10% or less, but it really is an evolution because one big issue is sometimes people don't have symptoms at the point of testing, but then they go on to have symptoms in a short time later. So pre-symptomatic and asymptomatic are not the same thing. And the difference is it tells us how we might do public health control measures and whether screening for symptoms is really as useful as we think. So the story is still not clear, I'll be honest, and I think it's hopefully going to get clearer soon.
More testing. We're all eager to see some data, I know, from more testing. Dr. Curry, next question for you. How do doctors anticipate we return to a new normal? Temperature checks in every workplace until a vaccine is found?
Well, I think it's going to be a phased return to normal, but there's two big variables that are going to have a big impact on how we do that. And the first is antibody testing. That may let us know who's been exposed to it and presumably may be immune to the COVID infection. The other issue is whether a vaccine becomes available. For now, it'll probably be a phased return as case numbers dwindle and we're able to test and identify and isolate cases, but good antibody testing showing immunity or a vaccine would change those plans dramatically.
All right. Dr. Saxinger, if you get sick with COVID and you recover and symptoms resolve, how long after the symptoms go away are you no longer shedding virus?
So this is a super important point, which is the tests that people talk about the most are actually testing a fragment of the virus, the nucleic acid tests, and those are usually the swabs. And those can remain positive for a very long time, and that can sound kind of scary. In the publications where they've actually taken the step of also looking for virus that they can grow in cell culture, the time is much shorter. And so in one particularly good study, it looked like in a moderately sick group of people that the virus could be found over the first week or so. And then over the next 2 weeks, so weeks 2 to 3 of illness, we saw antibody response going up, and we still saw that you could detect that fragment of the virus for a longer time. Mostly we think that people are generally most infectious within the first week of symptoms, and then it probably declines after that.
All right, we have about a half minute left, so let me ask you this question, Dr. Curry. You were working at the Delta emergency room just outside Vancouver. What are you seeing these days in terms of COVID-19?
So our numbers are actually down in terms of patients presenting, but with almost every patient coming in, COVID's a possibility we have to consider. So our volumes are down. However, the COVID cases are coming in, and they're coming in with very unusual presentations. So we've got to keep our guard up for every patient that comes in.
And Dr. Saxinger, can I quickly ask you, what's the perspective from Edmonton?
We've done a really good job, I think, making sure that we have capacity for a potential surge in cases, but we really haven't seen a true surge yet. We're seeing increasing numbers, and we're seeing people coming into the intensive care unit, but nowhere near the kind of catastrophic features that you see in some of the hard-hit areas. And so it feels kind of eerily quiet at the moment, honestly.
Well, of course, we all hope that will continue. Thank you both very much this evening.
You're welcome.
Thank you, Ian.
And of course, we will keep asking your questions about COVID-19 each night on The National. You can send those questions to us, message us directly on Instagram at CBC The National, or send us an email at covid@cbc.ca.